Wow, the world may be breathing a sigh of relief from COVID-19, or is it? The panic, the lockdowns, the helplessness. We can't just watch them away so quickly. Before that, the world was shaken by Ebola, a terrifying outbreak that sent shockwaves across the continent. And just when we thought we could finally exhale, monkeypox crept in. But here is the good news. We made it through those crises. Congratulations to all who survived those harrowing times. However, here is the hard reality. The fight against infectious diseases is far from over. Right now, in different parts of the country, diseases like Lassa fever, diphtheria, and meningitis are on the rise again. This week on Health Options, we delve into these pressing issues. Why do these diseases keep resurfacing? And how can we protect ourselves? Later in the program, we'll explore natural remedies on Nature's Corner. I am Salwa Khalil Ibrahim, and as always, it is a pleasure to have you with us. What do you really know about infectious diseases? They are not just statistics in the news reports. They are right here in our homes, our communities, affecting real people like you and me. Let's break it down simply. Infectious diseases spread through contaminated food, water, and household items, often due to contact with infected animals, especially rats. Yes, those little rodents scurrying round our homes can be deadly carriers of Lassa fever, which is already spreading across 11 states. And then there is diphtheria, a ruthless bacterial infection that chokes its victims, attacking the throat and nose. Add to that meningitis, the silent killer that strikes without notice, particularly in the northern states during the dry harmattan season. But why do these diseases keep resurfacing? Could it be seasonal factors like harmattan, failures in our healthcare system, or something we are not just doing right? So let's put an end to the guesswork and hear from an expert who can make sense of it all. Stay with us. You are watching Health Options on the NTA, and joining me now is Dr. Jafaru Momodu, a pulmonologist at the National Hospital, Abuja, and a fellow of the West African College of Physicians. Many thanks for joining us, Doctor.
Thank you so much. Thank you for having me here.
Okay, let's start with the big question. Why are we still recording outbreaks of infectious diseases now? Especially we are seeing now Lassa fever, meningitis, and diphtheria in parts of the country.
Thank you so much for this opportunity to speak on this. We really need to understand the fact that man, as an entity, lives with other microorganisms, okay? And it's quite important that everybody is in the need for survival. Microorganisms, be it bacterial, viral, fungal, they are actually wanting to also exist, okay? And coexisting with man, man has to make such measures as to ensure that it doesn't become a problem to them. So in saying this, as just an introduction to it, the microorganisms are actually around us. They are all around us. And how we actually protect ourselves from them getting into places they are not supposed to get to is quite important, okay? And I could see from your initial introduction, we have the multi-marmot rat which lives in our houses, or some houses, okay, even in some farms. We're looking at also the weather now in terms of people harvesting, meaning there will be bush burning for farming. which will drive some of these animals that carry some of these microorganisms or germs out from the bush into the homes in terms of succor or looking for where to survive, okay? Then we also look at our own practices too. How do we handle our food? How do we handle what we eat? It's quite important. Then also our health-seeking behaviors, okay? If we have issues whereby diseases have come in or infected someone, how well do we care for it so that it doesn't spread to other people? So these measures actually determine how disease can actually spread, become infectious, and become really a problem to everyone. Then also, when someone is ill, how well has that person be able to seek for medical help? And looking into all the enlightenments that have been happening, be it from vaccination, immunization, how well have we been immunized or vaccinated as we may see within our country?
Okay, we'll come to that later, Doctor. But will you say it is a seasonal something, or is there something where fundamentally that we're doing wrong?
Okay, thank you so much. I will really put, it's actually multifactorial in terms of these infections coming back. Some could be seasonal, just as I've said. There are some seasons, there are some seasonal peaks where Lassa, for example, actually peaks. So around this time where people are harvesting some of those crops and burning those bushes, these rodents tend to move away from this farm where they have the food source and get into the homes. So seasonal affectation too could also happen from that areas. But others could be as far as just having the right inoculum. What I mean is the right exposure to these organisms and then getting infected with this disease. And it's quite important we actually know about some of all these ailments that can actually cause harm to us.
Now, how exactly do these diseases spread? I know we've been talking about a rat now, but among human beings now, we are seeing other people getting infected. And what are the early warning signs people should never ignore?
Okay, thank you so much. Diseases can spread. It could be airborne, it could be waterborne. Okay, it can spread directly from human to human, from animals to human. Okay, so it's quite important. There are various routes of which diseases can actually enter into the body, or germs enter into the body to cause disease. There are lots of things that some people do majorly as practices that could also affect their health. And quite importantly is the fact that someone who is exposed to an airborne disease and someone coughs or sneezes around that person, it's also a potential for the person to get affected or infected with that particular disease. Take, for example, diphtheria. It's airborne. And just imagine a child who is in school who also similarly will just be looked at, oh, he's just coughing and has fever. And other classmates are sitting close to him. They get to inhale these organisms and they can come down with that infection. Also from close relatives that will be in the house that will share things with them, the also possibility of spreading infection through fomites, okay, from materials that are being used or shared by the family. So there are lots of ways that things that we do, we take actually quite common, like, okay, this is just this, it's going to go over. And the way we downplay on some particular symptoms, most times we see some persons coughing for quite a long time, over 2 weeks, and they'll be like, the cough is going to go, the cough is going to go. These are signs that should tell you that, oh, there might be something wrong here. Could it be tuberculosis? Could it be any other chest infection? So they are quite important. We shouldn't downplay on symptoms and our health-seeking behavior too. How well do we really say, oh, I'm not feeling too well, let me get to the hospital and get the checks? I know there are some bottlenecks where people would say, okay, there can be long queues or it's going to be a long day just to seek help. But how well do we really want to get well or seek help? So those factors, they're actually multifactorial. I can go on and on and on and on practices that we do that actually reduces our chance of curbing these infectious diseases.
Okay. Earlier, I know we started talking about hygiene, which, of course, I know you mentioned, and we all know, cannot be overemphasized. How much of a role does it play in preventing infections? And does immunity really, makes a difference in all this?
Okay, that's a 2-in-1 question. Yeah. I'll put it like that. Okay. The hygienic nature you cannot but overemphasize on the need for hygiene. It's quite important. Be it from everything around you, all to be hygienic. Coming from you yourself in terms of how you take care of yourself, you bathe, wash your hands, brush your teeth, they are quite essential. To even the hygienic nature of how your household looks like and its surroundings, they are very, very important per se. Then when we talk about herd immunity, we're looking at a relationship to maybe some of the vaccinations that you get, whereby if there is some sort of herd immunity, the rate at which this infectious disease is going to cause problem is quite reduced. For instance, COVID, we've had lots of people who have vaccinated for COVID, and as you can see, the increase is not as much as it is. And that also reminds me, if you look at what's been happening now, and especially in Lagos, where we saw the diphtheria cases, if you take a look into some of the reasons why diphtheria can still bring its ugly head out, is the fact that our immunization, how many people have really gotten those immunizations, the DPT vaccines at 6, 10, and 14 weeks, and even the booster. Some people stop just on just those 3 doses that were given to them as children, without even looking at the need for even some of the booster doses that have been recommended, even at 4 to 7 years, even up to 10 years, and then 10 yearly, to actually help prevent this. How many of us are really vaccinated?
Okay, doctor. Now, let's take a break here. We'll come back shortly. Stay with us.
Kuka that's the name in Hausa.
That is call it Ose.
In Yoruba.
Ose, Igi Ose.
Okay, so I know it's Kuka.
I am delighted to have you join us on Health Options, the program that not only tracks government policies on health.
The total cholesterol is made up of some components. The high density lipoprotein, which is the good cholesterol, the low density hypoprotein, which is the bad.
Cervical cancer, a type of cancer that develops in a woman's cervix.
There were opportunities for women to get screened for both cervical and breast cancer, maybe up to 30,000, but we'll be having figures of 5,000.
Welcome back. If you're just joining us, you are right on time to discuss what really matters, solutions. Dr. Momodu, can these diseases be prevented, or are they just at the mercy of nature?
Okay, thank you so much. So diseases can be prevented. It's quite important that we follow some key things in terms of prevention of disease. Normally we would look into in entirety, first of all, primordial levels of prevention, which is very, very important, whereby we have the government's political will into helping with programs that can help sort out algorithms that will help to prevent diseases. Then primarily, we should look at how we can actually health educate, which we are doing now as part of this program. We are health educating people about these diseases and even possibly the symptoms and the need to go get help. So then, secondarily, we want to treat this early diagnosis for these patients and treat them when they have some of these diseases. I'm putting all of this in the sense that I know for this particular discourse, we're doing more or less of the primary, okay. In terms of vaccination, people who need to vaccinate needs to go for their vaccination. Forget about some of the myths. If you have any challenges with these myths, you can go walk up to any health care professional or practitioner and let them explain this to you. Exactly. Really what these vaccinations or immunizations entail. Then your personal hygiene, which is quite key. With personal hygiene, you should be able to, as much as possible, take away these germs as far as possible. As simple as hand washing. If you look at studies, look at researches, and even if you practice hand hygiene, you notice that there are lots of things, benefits in short that you will get. And you know, one of the fastest ways to the mouth is through the hand. Someone can shake someone who is actually diseased, and the next minute is picking something up to eat, and also taking in those germs and falls ill. So even as simple as the good hand hygiene practice, those can help prevent diseases. Then when you see symptoms happening that you really cannot explain, good health-seeking behavior to quickly get there. You understand? This can also help. And I will not forget to reemphasize that we need to keep health educating people at every slight opportunity we have. Health education so that people are a bit prepared for it and know how to avoid being infected.
Okay. Now, will you say vaccines are the best option? I know you just spoke about vaccination now and the myths surrounding it. And then in Nigeria, we know we have a lot of issues around vaccine. Are we doing enough?
Okay, thank you so much. Vaccines are one of the ways you prevent diseases, especially those that have vaccines, right? For several infections, we've been able to at least get some vaccines that could help the populace. But there are some that you really don't have vaccines for. But why don't you take this vaccine, which you know is going to help you prevent a particular disease from happening when the vaccine is available? Let's not talk about much of whether the vaccines are available or not.
Yes.
Because I know everybody in terms of the healthcare sector is trying as much as possible to do what is needed. And I know with much encouragement, as I've said before, primordial ways, the government's political will and commitment can also help fast track this. Donations from goodwill, good meaning individuals, NGOs could also help to provide some of these vaccines that could be of benefit and people get to take them. So it's not that they're not doing something, but we still need more to actually get good coverage of vaccinations and also herd immunity, in quote, to help us.
And on a final note now, what's the biggest myth you've heard about infectious diseases and what's the reality?
Thank you so much. What I might say before I answer that question is the fact that your health, you are responsible for your health, and whatever happens in terms of your health care, you are also part of the management in ensuring that you are healthy, because health is wealth. Several myths have actually come in. I wouldn't say one is the biggest or which one is smallest, but whatever myth it is that would come in, please, it would be nice to meet a healthcare professional to help you demystify some of these myths, and so that you can actually get the best out of care for yourself.
Okay, Dr. Jafaru Momodu, thank you for the eye-opening conversation and coming on Health Options.
Thank you so much. Thank you.
Just as the Hippocratic Oath reminds us that doctors treat, but God heals, we now turn our attention to nature's solutions. Let's welcome our in-house nature expert to share insight on natural remedies for boosting immunity and preventing infections.
Non-communicable diseases are diseases we grow into while journeying on the earth. From the days we are born by our parents, as we age into them. And I am worried, and WHO is worried, because of the increasing tide of the non-communicable diseases. You are standing giving a lecture, before you know you slump, because the cardiovascular system, the arteries, the arterioles, the capillary tubes get narrowed by the plaques coming out of this fat we take and all the rest. And before you know, the vessel that is conveying blood to the brain gets clogged up. For a second of it, you already have a heart attack. You are falling down. You are dying. And these are things that can be prevented by the intake of garlic, the intake of beet juice in the morning. What does it do? It has nitrates. It expands. Strawberry improves the heart function, and so on. Are you talking of respiratory system? respiratory system complicate a lot of things during COVID and what have you. Do you know that mere use of garlic, mere use of ginger, mere use of turmeric has effects on our respiratory system? Even moringa will keep a stem to asthma. The use of moringa. The asthma, that's a very, very serious issue. You have to give aminophylline into the blood to help arrest asthma attack. Moringa can do that. And in the same form we have told you before, you dry it, you make tea out of it, or you use it in the cooking, enough quantity in the soup you make out of them and all that. In Nigeria we have had, even people that have diabetes, they want to cut their legs, they have eye issues, cataract, glaucoma, these simple mixtures of even the orange, the grape, the orange itself, the tangerine, helps to clear cataract. The mixture, 60% of red onion to white onion, clears cataract, glaucoma, and brings down your sugar. They are as effective as glucophage, but without the side effect of glucophage, from the research work we've done. So that is that for diabetics. The chief of them all, I want to release it in this interview. Many families, man and woman and their children, have ulcer. You may be a married man and your wife. You, the husband, may have a higher effect of the ulcer than your wife. In another couple, it is the wife that has the highest effect of ulcer than the husband. This is how most families live, with ulcer. And when they give birth to their children, all of them pass through the system, so they took the ulcer. A lady can be of 18 years old. She's now crying. Menses has not started coming. Menses is coming with deep pain, with serious waist pain, and all that. Hormonal imbalance. And these things will be there for a very long time. One is on Zantac, one is on omeprazole, one is on Flagyl, one is on amoxicillin, one is on Gestid. But this thing continues to go up and down, up and down, up and down. Ulcer is the basis, is the one behind most of the ill health. From the research work we have done, we can say this. And these things can be taken care of by using these combinations we have given you. They will take care of all the mega bugs, ulcer and typhoid. They are the ones always there in every human system. So there's a need to have a tide of them. Once you're on these bitter taste things and sour taste things, those things will quickly run out of your system and you regain your health, and you will be surprised.
So soon? Yes, we have come to the end of this edition of Health Options. But before I go, here is some food for thought. An ounce of prevention is worth a pound of cure. Infectious diseases don't wait for the perfect time to strike. They attack when we let our guards down. So let's take responsibility. Practice good hygiene. Stay informed. Protect your loved ones. Remember, you can watch these episodes and previous ones on YouTube at the NTA Networks. We'd love to hear your thoughts, questions, and suggestions. Thank you for watching. I am Salwa Kalel Ibrahim. Goodbye.